Hi, my name is Bill Chey at the University of Michigan in Ann Arbor, Michigan. I'm a professor of medicine in the Division of Gastroenterology at Michigan. And I wanted to talk to you today about some recent developments about a very popular and commonly used drug for acid reflux. I think at some point all of us have had symptoms of heartburn or regurgitation, which are the principal symptoms that suggest the presence of acid reflux. One of the key drug classes that are used to treat patients with heartburn and regurgitation are called histamine 2 receptor antagonists. These drugs block a certain receptor on cells lining the stomach that are responsible for releasing acid that can then cause the symptoms of acid reflux like heartburn and regurgitation. Histamine 2 receptor antagonists, or H2 antagonists, block that receptor and in that way reduce the amount of acid produced in the stomach. And in this, of course, leads to an improvement in acid reflux related symptoms. One of the most popular H2 receptor antagonists is a drug called Ranitidine or Zantac. Now, recent studies have actually identified that some formulations of over-the-counter and prescription Zantac are associated with the presence of a contaminant called N-nitrosyl dimethylamine, or NDMA. It also turns out that studies that have been done in the past have associated elevated levels of NDMA with an increased risk of developing certain types of cancer, like, for example, pancreatic cancer. The studies that have been done more recently on Zantac have identified that the longer a product has been sitting around and the more it's been exposed to high temperatures, the greater the likelihood of contamination with NDMA. The good news is not all Zantac preparations are contaminated with this particular chemical, but unfortunately there's no way at the current time to really determine which ones are and which ones are not contaminated. And for that reason, the FDA did the appropriate thing, and that is made a recommendation on April 1st of 2020 to withdraw all over-the-counter and prescription formulations of Ranitidine. The trade name, by the way, is Zantac. Now, I know that's concerning to a lot of people because heartburn is so common and people so commonly use Ranitidine or Zantac, but realize there are lots of other alternative medications that one could employ to take care of your heartburn and regurgitation. So within that same class of H2 receptor antagonists, there are a number of other drugs which have not found to have that contaminant, that NDMA. So, for example, Tagamet or cimetidine has not been found to contain that contaminant. Nizatidine or Axid, or famotidine or Pepsid Complete. All of those are fine to continue to use as far as we know at the current time. If you need something a little bit more potent than an H2 receptor antagonist, you could think about a proton pump inhibitor. Drugs like omeprazole or Prilosec, esomeprazole or Nexium, or lansoprazole or Prevacid. All of those are fine to continue to use. Remember that H2 blockers tend to work more quickly but aren't as potent. Proton pump inhibitors tend to take a little longer to achieve their maximum benefit, but they're the most potent drugs as far as medical treatments for patients with heartburn and regurgitation. So it's really important for folks listening today to realize that the FDA has withdrawn all over-the-counter and prescription formulations of Ranitidine. You should stop taking those immediately. If you have further questions, you should consult with your physician. I hope you found this information helpful today.